Hi, I'm Dr. Paul Howard, a real board-certified plastic surgeon in Birmingham, Alabama. Welcome to my Faceliftology video blog. Today we're going to talk about eyelid surgery. For those of you in the medical business, blepharoplasty. Eyelid surgery is probably the most common operation done at the same time as facelift. Although eyelids can be done on people as young as 20, 22 years old or as old as 80s or 90s. Regardless, I'm going to talk about eyelid surgery in the realm of doing facelift and facial rejuvenation. For us, when we do mid-face lifts, the number one eyelid surgery that we generally perform is a lower eyelid blepharoplasty. And the reason for this is that when you lift the mid-face, you lift the cheek tissue such that you get nicer cheekbones, but what you also do is you decrease the amount of skin that's eyelid skin that's pulled down onto the face, causing black circles. When you lift this, it creates a crepiness in the lower eyelid that has to be addressed. Also, many people have fat in their lower eyelids, and we have to remove or replace that fat also. And the final thing we have to do with lower eyelid surgery, and this is very important and has to be done on everybody, is we have to blend the lower eyelid tissue with the cheek tissue. This blending of the lower eyelid and the cheek has probably been the hardest thing to accomplish in surgery to date. But we think we've got a procedure that does it well basically every time. What it amounts to is that after the mid-face lift, we do a small incision approximately 3 millimeters below the cilia of the lower eyelid. That is that we keep the incision low enough where we don't cause what's called a round eye, and we very rarely get scleral show after the operation. We do a skin muscle flap, which is basically a deeper tissue flap. We do not remove fat from the lower eyelid. We suture it back into position where it's supposed to be, tightening the structures around there and also dissecting over the rim so that we can blend the lower eyelid tissue with the tissue of the cheek. When you do this, you get a smooth transition rather than the crescents, the dark crescents that most people have. This is probably the single most important thing that we do in eyelid surgery. Many people also have to have their upper eyelids done, and this is a much simpler procedure. Basically just removing the excess skin from the upper eyelid. If there's any fat to be removed, we do remove a little bit of fat from the inside of the upper eyelid and just be very conservative in the amount of skin that's removed. We always do the lower eyelids first and then fit the upper eyelids to the lower. Thanks for listening to this edition of the Facelift video blog, and we hope to see you on our next edition.